I rise in opposition to the rule. And while I appreciate my good friend's clarification that this rule has to do with a credit card bill that's on the floor today, I take this opportunity respectfully to speak about that issue which is foremost in the minds of the American people at this hour. And that is this freight train of big government moving through the Congress at a frightening speed that we believe with all our hearts will result in a government takeover of health care in America. After months of behind closed doors dealings, the Democratic majority, in cooperation with the White House and special interest groups, produced late last week finally a bill. It may be amended again, Mr. Speaker, but we have a 1,990-page bill that, according to independent press estimates, includes $1.2 trillion in new federal spending on expanded health insurance coverage over the next 10 years. It includes $729.5 billion in new taxes on small businesses and individuals. It is, in every real sense, a government takeover of health care. And the burden and payment of which will be borne principally by Americans that make less than $200,000 per year. An independent estimate that we received yesterday, as Republicans spent hours reading the bill in our reading room, was that actually, despite the fact that as a candidate, President Obama pledged that he would not raise taxes on Americans who make less than $200,000 a year, the Pelosi health care bill actually, the tax increases would fall most squarely on Americans making below that threshold amount. 87% of the taxes that are being levied in the Democrat health care bill will be paid by Americans that make less than $200,000 a year. Fees and mandates and fines and penalties falling squarely on our middle class. It's really extraordinary when you think of it that it's taking place during what is, without debate, the worst recession in a quarter of a century. But it doesn't just stop there. When we say that it's a government takeover of health care, we are talking real numbers and real bureaucracy. Those that say otherwise ignore the fact that in this legislation there are 43 entitlement programs that are created, expanded, or extended. There are 111 additional offices, bureaus, commissions, programs, and bureaucracies that the bill creates over and above the entitlement expansions, and it included in the prior bill. And lastly, we all know as legislators that the word shall is not a friendly word when it comes in a law. When the word shall appears in a law, it means that someone must do something. A business, an enterprise, an element of the bureaucracy shall take action. The word shall appears in the Democrat health care bill 3,425 times. And yet the majority in the administration continues to insist that this is not a government takeover of health care. I have to tell you, Mr. Speaker, the American people are catching on, and they know otherwise. But the good news is there's an alternative. People can go to healthcare.gop.gov, and as has emerged in recent days, Republicans have a bill. I know our colleagues have been pointing at some blank pages on the floor in the last 24 hours, but the American people surfing the net know that the Republican bill is actually a little bit over 200 pages, allows Americans to purchase health insurance across state lines the way big businesses can, allows associations to pool their employees to bring down the cost of insurance. It brings about medical malpractice reform to end junk lawsuits and end defensive medicine in America, and we use those savings to actually strengthen those funds at the state level, those programs that cover pre-existing conditions for Americans. While the majority is focused on growing government to achieve something called universal coverage, Republicans are focused on what the American people want us to focus on, and that is lowering the cost of health insurance and lowering the cost of health care by giving the American people and American enterprise more choices, reasonable limits on litigation, and helping people with pre-existing conditions. And I yield back the balance of my time.
Gentleman yields back the balance of his time.